on exposures, where people are being exposed to the virus, does the province have a sense at this point in time? We talk a lot about these events, that are problematic or ill-advised, but we've also had a number of outbreaks and exposure events linked to workplaces. I previously asked the Health Ministry if they can provide even a rough sort of estimation or rough figures of how many people acquired infections at work versus how many people, were out at a party when they were exposed. And I'm wondering, Dr. Henry, if you have any information on that front at this point.
Yeah, it is. It's complicated. We ask those questions all the time, and I do have a rough breakdown, and it varies, and it varies over time, and it varies by health authority. So, for about a third of the cases that we're seeing now are related to events like parties, like some of the exposure events at clubs and nightclubs that we've seen. And about a third are related to transmission within families and community groups. And so sometimes it's a mixture of both. So somebody may be at work and been with a coworker and then brought it home to their family, and transmission in families. And then about a third are related to some of the other exposure events, like you say, like a workplace cluster, for example, or outbreaks in long-term care homes. I think the important thing for us, though, when we look at this is when we identify a case, when somebody tests positive and public health is talking to them, can we link them to a known exposure event? And that's something that we take very seriously, because it's those unlinked cases that we are most concerned about. I should say that a proportion, about 20% of our cases overall, a little bit less now, but are related to travel, so international travel and travel to other provinces as well. So it breaks down a little bit like that, but it varies over time depending on what's happening.